Hello
Hello
everyone!
everyone, I am Lantajo,
And I am Clarice Joy Ardela Pena.
and for
today,
today,
we
we
are
are
the
the
Sulfonylureas
Sulfonylureas
first
first generation. And in this video, we're gonna tackle everything about us. So without further ado,
Let's get started.
My generic names are acetohexamide, chlorpropamide, tolazamide, and tolbutamide. My brand names are diabetes, tolinase, orinase, and dimelor.
Indicated below are my chemical names.
In my drug classification, I have here therapeutic and pharmacologic. So in the therapeutic drug classification, I belong in the Sulfonylureas first generation. So in this class of medications represents a group of anti-hyperglycemic agents mainly used in the treatment of the type 2 diabetes mellitus. And in our group, we act by increasing insulin release from the beta cells in the pancreas. So in the pharmacologic drug classifications, we belong to the oral anti-diabetic agents.
My pregnancy category is letter C because there are still no well-controlled studies in humans about me, but potential benefits may warrant when using me in pregnant women despite potential risks.
Now let's go to the mechanism of action of sulfonylureas first generation. So what we usually do is we increase the release of insulin through the stimulation of pancreatic beta cells. We do this by binding to a subunit of potassium ATP-dependent channels that are known as the sulfonylurea receptor. So this class of medications impedes the cellular release of potassium, leading to cell depolarization. So as a result, an inflow of calcium into the cell occurs and causes an increase in insulin exocytosis. So we consequently are a more potent medication in the earlier stages of type 2 diabetes when a patient has an increased pancreatic beta cell function. So we also lower plasma glucose concentrations in diabetic patients by stimulating insulin secretion and by potentiating the biological effect of the insulin on such tissue as skeletal muscle, fat, and liver. The mechanism of the latter, so-called extrapancreatic effect, may be activated by increasing the growth and sensitivity of insulin receptors on other tissues like the muscle, fat, or liver cells and triggering hepatic gluconeogenesis.
I am administered orally, metabolized in the liver, and excreted through urine.
Take a look at this table. This shows our pharmacokinetics considerations.
For the indications, we are indicated for patients with type 2 diabetes with blood glucose levels that are higher than the recommended levels. So this is usually once metformin has been prescribed. Sulfonylureas are a class of oral tablets medication that control blood sugar levels in patients with type 2 diabetes by stimulating the production of insulin in the pancreas and increasing the effectiveness of insulin in the body. So I will be presenting to you some dosage per drug. For acetohexamide, with the brand name Dimelor, the dose is 500 to 750 mg once a day or can be divided. The next is chlorpropamide with the brand name Diabetes. The dose is 100 to 250 up to 750 mg once a day or twice a day. Then, tolazomide with the brand name Tolinase, the dose is 250 to 500 mg per rm once a day or divided. Then tolbutamide with the brand name Orinase, we have the dose of 1000 to 2000 mg once a day or divided.
I am contraindicated to patients with type 1 diabetes, to those with significant hepatic impairment, to patients with renal insufficiency, to elderly patients, and to pregnant women because of potential adverse effect on the fetus.
I am also contraindicated in patients allergic to me or any alike components as my medicine to avoid hypersensitivity reactions. Another is for lactating mothers. Some of these drugs cross into breast milk. Then, to children, because the safety and efficacy of these drugs for use in children have not been established. Also in obese patients and contraindicated in alcohol.
Along with the needed effects of the sulfonylureas first generation, we may also cause unwanted effects. Although not all of these effects may occur, if they do, they may need medical attention. So first, the central nervous system. In here, we may cause dizziness, trouble concentrating, loss of coordination, confusion, restlessness, nervousness, drowsiness, headache, weakness, fatigue, and slurred speech. For the cardiovascular system, we may cause heartburn and fast heartbeat. For the gastrointestinal, we may cause GI discomfort, bloating, anorexia, vomiting, nausea, hunger, upset stomach, stomach cramps, constipation, and diarrhea. For the eyes, ears, nose, and throat, we may cause blurred vision. For the genitourinary system, we may cause dark-colored urine. For the metabolic, we may cause weight gain. For the integumentary system, severe rash, redness, itching, allergic skin reactions, easy bruising or bleeding, sweating, hives, increased sensitivity of the skin to the sun. For the hematologic, we may cause low blood sugar or hypoglycemia.
Some nursing responsibilities before administering me includes assess for contraindications or cautions, such as history of allergy to the drugs and pregnancy and lactation status. Next, perform a complete physical assessment to establish baseline status before beginning therapy and to evaluate effectiveness and any potential adverse effects during therapy. Next, assess orientation and reflexes, baseline pulse and blood pressure, abdominal sounds and function. This is to monitor effects of altered glucose levels. Next, assess body systems for changes, suggesting possible complications associated with poor blood glucose control. Next, investigate nutritional intake, noting any problems with intake and adherence to prescribed diet. This is to help prevent adverse reactions. Next is assess activity level, including amount and degree of exercise, which can alter serum glucose levels and dosage needed.
It is also part of the before nursing responsibilities to provide patient and family education about the following. Let them know to ingest some form of sugar, for example, orange juice, dissolved table sugar, corn syrup, and honey if symptoms of hypoglycemia develop and seek medical assistance. Tell them to check their blood glucose as prescribed by their physicians and to not take any other medications unless approved by them. Educate them also that alcoholic beverages may produce a disulfiram type reaction, so they must avoid drinking this. Also tell them to avoid prolonged direct exposure to sun to prevent photosensitivity reaction. Let them know to report dermatologic reactions such as rash or itching. And then lastly, do not let them breastfeed while taking this drug without consulting their physicians.
Now for the during nursing interventions. So first, as a nurse, you should administer the drug as prescribed in the appropriate relationship to meals. This is to ensure the therapeutic effectiveness of the drug. All sulfonylureas are taken orally, and to improve efficacy, medications in this class should be taken about 30 minutes before meals. Next, administer with low starting dose with an increase in dosage every other week until achieving effective blood glucose control. You should also ensure that patient has dietary and exercise regimen and using good hygiene practices to improve the effectiveness of the insulin and decrease adverse effects of the disease. You should also monitor nutritional status to provide nutritional consultation as needed. Monitor also response carefully, because blood glucose monitoring is the most effective way to evaluate the dose. Obtain blood glucose levels as ordered to monitor drug effectiveness. Monitor also the patients during times of trauma, pregnancy, or severe stress, and arrange to switch to insulin coverage as needed. You should also provide comfort measures to help patient cope with drug effects, and provide patient education about drug effects and warning signs to report to enhance patient knowledge and to promote the compliance. Now I'm going to be sharing to you the during nursing interventions for the drug acetohexamide. So, you should administer daily dose before breakfast, then divided doses are given before breakfast and dinner. Now store at 15 degrees to 30 degrees Celsius unless otherwise directed. Then you should also monitor blood glucose levels closely during first 24 to 48 hours after therapy is initiated or the dose is changed. Then monitor for signs and symptoms of hypoglycemia or exaggerated hypoglycemic response, particularly in older adults, malnourished and debilitated patients, or those with impaired hepatic, renal function, adrenal, and pituitary insufficiency. Lastly, for lab tests, periodic blood glucose, hemoglobin, and liver functions should be checked.
Nursing responsibilities after administering me includes monitor patient response to therapy, stabilization of blood glucose levels, monitor for adverse effects like hypoglycemia and gastrointestinal distress. Next, evaluate patient understanding on drug therapy by asking patients to name the drug, its indication, and adverse effects to watch for. Lastly, monitor patient compliance to drug therapy. Wow, it's a wonder how sulfonylureas work for the body, right?
Yes, so it's important for you to understand and remember these drugs.
So that's it for this video. I hope you learned something about us, the sulfonylureas first generation.
Bye!